Welcome to our virtual tour of the Radiography Lab. The Radiography Lab is located on the third floor of the L building. We're directly upstairs from the library on the downtown campus of Cape Fear Community College, and we're in the same building where the bookstore is located. The lab is used in nearly all of the radiography courses, including such classes as patient care, where we learn to safely transfer patients on and off the table, as well as learning about monitoring vital signs, hand washing, and sterile technique. We also use the lab for positioning. The students practice correct positioning for X-ray exams prior to actually performing these exams in the clinical setting. And we also have several imaging courses. In these instances, the students actually produce X-ray images using our various phantoms in order to see the results of technique selection and positioning. Our imaging consists of three primary methods. As you can see on these light boxes, we have film with a darkroom. We don't use that in a medical setting these days, but we have the capability to reproduce images using film, which helps the students understand the functioning of various X-ray power techniques and power levels. Additionally, we have two computed radiography systems. These are also known as CR. This is a digital imaging methodology which uses imaging plates and laser scanners to produce images on the computer. Our newest system is a direct digital imaging system. This uses a flat plate detector to capture images directly onto a computer. This produces X-ray images with a read time of approximately 10 seconds, so it's very quick. If you would come with me into the energized lab. As I said, our lab has many anthropomorphic phantoms and positioning aids for the students to use. In addition to the smaller phantoms, such as the knee, elbow, and foot, we also have a complete skeleton, an anthropomorphic phantom, which we can use to image the entire human body. This particular phantom has a material, it's constructed of a material that mimics very, very closely human flesh. So any technique that works with this phantom should work with an equivalently sized human patient. This laboratory is energized. This X-ray tube has the ability to take actual X-rays. So in addition to using this area for positioning, we can also make images and examine the factor changes and the effects they have on the resulting images. The energized room also has a large leaded glass window. This protects the operator from radiation during radiographic exposures, and the entire room is lined with lead, which also protects us from X-ray. Okay, so here we go. In addition to the energized X-ray tube, we have two systems that are not energized, but in every other aspect completely functional. These units are used for positioning practice when we have the students in laboratory. And any positioning that can be done at the hospital can be performed right here using this table and this accompanying chest stand. Our third imaging system is our newest. This one is very automated. When the students set a technique, they for example, they decide they're going to do a chest x-ray with this machine, they only have to sit and then push the button, and the system automatically maneuvers into place for them. Now the only adjustment necessary is accommodation for the patient's height. We have one more system. The portable x-ray machine is used by the students to simulate portable bedside radiography. This is something that comes in very, very frequently at the hospital, where inpatients sometimes cannot be brought down to the main department, or emergency room patients that have recently arrived and are not yet stable can be radiographed in their bed without having to transport them down to the ED x-ray room. As you can see, our lab is fairly small, so we have our students divided up into groups of 9 at most, supervised at all times by 1 or 2 faculty members. Thank you very much for attending this brief tour of the radiography laboratory. We hope that it has given you a better idea of what to expect during the lab portion of our curriculum.